Hello, today I'm going to be demonstrating the procedural steps for inserting a nasogastric tube. First, you're always going to want to have suctioning available, and then next you're going to place the patient's bed in a high Fowler's position. Then you're going to assess the patient's nares with the pen light, and to assess the patient's gastric reflex, you are going to place the tongue blade against the patient's uvula. And you're going to always want to make sure that the patient knows how to communicate during the procedure. Then, using a tape or permanent marker, you are going to measure the tube for the length of insertion. Then, you are going to place a towel over the patient's chest and have the patient hold an emesis basin and a cup of water. Then, you are going to coat the tip of the tube into water-based lubricant, and you are going to slowly insert the tube into the nares. And you're going to instruct the patient to touch the chin to their chest. And you're going to advance the tubing each time the patient swallows until you reach the marked level of insertion. If at any time you meet resistance, such as coughing, gagging, or a change in vital signs, you're going to withdraw until it resolves. Then you are going to assess the patient's throat with a pen light, and you are going to auscultate for breath sounds. Then, using a large syringe, you are going to withdraw the gastric content, assessing the aspirate and checking the pH. Then you are going to anchor the tube to the patient's nares, and then you're going to mark the spot that is next to the patient's nares. Then you're going to want to make sure you attach the tube to the patient's gown, and then you are going to ensure that the patient's bed and to make sure their head is always above 30 degrees. Thank you.